All right, hello everyone. I'd like to give you an update to this year's virtual ASA annual meeting. So as you all know, who doesn't, about the COVID pandemic that gripped the world in 2020 had significant changes to the way we conduct our academic business. And just like in all the other specialties, the anesthesiologists also had their annual meeting, which was scheduled to take place in our nation's capital, Washington, D.C., this past October. Was unfortunately not able to be held there, but we had to go 100% virtual. Nevertheless, the American Society of Anesthesiologists still did a tremendous job, and they were able to put together in a record short time a very comprehensive and well-organized virtual meeting. It was held from October 3rd to October 5th. And it had all the elements of what a in-person meeting would have, with wonderful lectures of scientific nature, also leadership lectures, and also advocacy lectures, which were all very well attended. This meeting actually was one of the best attended meetings ever, with over 13,000 registrants. I have some numbers here. There were 6,800 active members, 2,810 residents, and almost 2,000 medical students that signed in and attended this year's annual meeting. There were wonderful lectures being given from many people from around the globe, and they were able to organize this in a well-cohesive fashion so that it actually went down without a glitch. I spent the weekend on many of these lectures as well, and I have to say it went much better than initially anticipated. Unfortunately, we weren't able to be there in person, so many of the personal interactions that we have, many of the discussions that you can only have in person could not take place, but I thought it was still an excellent meeting. Some of the highlights from the meeting obviously were the opening ceremony, where our Surgeon General Jerome Adams, who is a trained anesthesiologist, gave a fabulous talk, and I would like to mention at this point that he actually gave a shout out to our Department of Anesthesiology here at MSK. He talked about Grant Chen's efforts. Grant Chen is one of our pain physicians and anesthesiologists who developed, together with biomedical division, an intubating box. It's a box out of plexiglass under which you can put over the patient, with cutouts for the arms of the anesthesiologist, which make intubating safer. And it was very nice to hear that the Surgeon General actually gave our department a shout out. Other lectures were obviously the Rovenstein lecture, which was held this year by Dr. Joanne Conroy, and she's the CEO and president of the Dartmouth-Hitchcock system. She's also a trained anesthesiologist, and this was basically an interesting lecture, hearing how anesthesiologists can promote themselves and get into hospital leadership positions. And finally, the Serving House lecture, which was held by Dr. Beverly Orser from Toronto General Hospital, which was a very interesting lecture talking about the long-term effects of anesthesia and surgery, and how what we do in the operating room can actually play an important role for the long-term outcome of our patients. The political aspects of the meeting were also all held virtually. Many of the committee meetings, for example, the committee that I chair, the Committee on Cardiovascular and Thoracic Anesthesiology, we also had our committee meetings virtually, and this went along quite well, better than I actually expected. The only little small hiccup that was there was the House of Delegates. The first meeting went along well. The second meeting with the voting had to be, however, stopped, and we will be meeting in the coming weeks to complete voting for this. So that was basically it. It was a successful meeting. I think we learned a lot on how to put the meeting like this together from a virtual sense, and hopefully next year we will be able to at least have a in-person meeting. It will probably be a hybrid type of meeting, where some of it will be in person, some of it will be virtual, just like this year. So thank you for tuning in, and I look forward to seeing you at next year's ASA.